Hello, welcome to mricardiac.com. This month, we will be doing a series of lectures on how to improve CMR image quality. And to begin with, we deal with difficulty in breath holding. So patients with cardiac ailments will have definitely poor breath holding capacity, and this will significantly deteriorate image quality. But by changing certain parameters, we can still get reportable images. Let us learn how. It is most important to talk to the patient and reassure him. We can keep a relative inside the MRI room. Always explain him the importance of the test, make him demonstrate before the scan, and go ahead with the scan. This definitely helps. For adjusting parameters, it is important to learn certain terms on the exam scorecard. So basically, the number of phases which denotes the number of frames or segments obtained in each cardiac cycle between two RR intervals. So this is basically detects the number of time represented by each frame of the cardiac cycle. By reducing the number of phases, we can reduce the time of acquisition, but however, it will reduce the or degrade the image quality. Ideally, for functional calculation, it is recommended to obtain at least 25 to 30 phases, which will lead to temporal resolution of 40 to 50 milliseconds. So as we see over here, phases have been reduced. This has reduced the time of acquisition, as we see in this case. But this TR basically denotes the temporal resolution, which has also increased in number, and this will deteriorate the image quality, degrade the image quality. So good temporal resolution, it is essential for any moving structures, as we see in the case of photography. And in case of cine images of cardiac MR, the time of cardiac cycle represented by each frame, that is temporal resolution. And ideally recommended values are between 40 to 50 milliseconds. By reducing number of phases, we will reduce the time but further deteriorate the image quality by reducing temporal resolution. Another important parameter we have to learn is spatial resolution. Basically, it is ability to detect the finer structures. Higher spatial resolution is especially important to detect smaller structures like PFO. And it is basically depending on the FOV and metrics calculation, we can get the spatial resolution. By reducing the metrics, as we see in this case, the time of acquisition will reduced, but it will deteriorate the spatial resolution. As we see in this case, the number of heartbeats per slices have reduced, but so is the image quality. So you always have to strike balance between the metric size and the time of acquisition. Reducing field of view in face encoding direction can be adjusted on the exam scorecard, as we see in this case. Basically, this will reduce number of face encoding steps and reduce their time, but there is always a chance that you may get wraparound artifact because of the overlapping structures, as seen in this case. So this is also one of the limiting factor. Most of the current scanners have parallel imaging. This is an advanced technique which uses a special coil design and an intensive computation. And there has been a lot of improvement in image quality after the era of parallel imaging. Basically, it uses the multiple array of coils to obtain a single image slice, and also the number of phase encoding steps are reduced using the acceleration factor. Increasing acceleration factor will reduce their time, but will significantly reduce or deteriorate the image quality. So it is important to balance the, to strike the balance. Multiple averages, reducing number of averages will reduce time. But again, as we see in this case, the resolution or the spatial resolution will definitely deteriorate. Compressed sensing technique is another very promising tool which is available in few of the current scanners. And with that, it is possible to obtain the entire cine short axis in a single breath hold. In patients who can do good breath holding, it is important to get adequate number of phases or maximize your phases and increase metrics so we can achieve good quality of images. So it is always a balance between different parameters, between the time of acquisition and spatial and temporal resolution to get good images. But depending on patient to patient, we can still go ahead and do the study and still get reportable images. Any feedback and suggestion, please mail us on info@mricardiac.com. This month, I'm sharing also my personal email address. So you have any suggestions for next topic or any other matters to be covered, please share it with me. Thank you.